birth in a traditional hospital setting, can she hire a midwife, and or a doula in a hospital
Absolutely.
setting? Okay, good to
Yeah,
know.
so it's pretty different the way that, you would seek those two things out. So birth
Okay,
doulas are independent. They don't typically, they're not hired by the hospital. They're hired by you. So you go and interview different doulas in your community, and you would hire one, and then they would be your doula. So they don't serve the hospital. They don't serve anybody else. They only really have your interest in mind, which is important to know, right?
right.
Midwives, on the other hand, there's different kinds. The kind of midwife I'm talking about is probably the most common, what people are most familiar with, which is the nurse midwife. Um, and those midwives are not, you don't tend to hire them independently like you do a doula.
Okay.
They tend to work in the hospital or in a clinic the same way that your doctor would work, at your family practice clinic.